Hello, scholars. My name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we described adjustment disorders. In this video, we're going to talk about dissociative identity disorder, which is now known as DID. In the past, you may have heard this be called multiple personality disorder, but because of the stigma surrounding this, a new name was chosen, which is dissociative identity disorder. In order to be diagnosed with DID, dissociative identity disorder, a person has to have two or more personalities, or sometimes they're called alters, which will come and go and disrupt the person's main identity. In some cultures, this can be defined as a possession, but different cultures don't always see it this way. Usually the person will feel like they are no longer themselves, that they no longer have control over their being, and their body may show changes in personality, behavior, memory, cognition, perception, as well as other elements. These changes in behaviors can be reported by family, friends, or others, or by the individual. In my professional opinion, as a doctor of psychology, I am going to differ from the DSM in what is considered possession. I'm also going to keep from talking about possession because I do feel like it is more of a religious context, and I don't believe that science has done enough to truly understand what possession is. B. The individual will have periods of time where they won't remember personal information, everyday tasks, or events, and even traumatic issues within their own life. This is not like an average forgetting of something. This is a large lapse in memory. C. This causes distress for the individual, and it can also negatively affect their relationships with others, or with their schoolwork, or within their occupational status. D. The shift to alters is not seen as acceptable considering a religious context or through the culture. And then E. The person doesn't have these issues because they are on an illegal drug, substance, or prescription that is part of a medical issue. It has been recorded by people that have DID that these different alters can become present for their own reasons or goals. The chance of the alters appearing can be dependent upon the level of stress the individual is going through. Whether or not the person fights having the alters come forward can affect how much the alter may come forward, and how strong a person's emotions are can dictate whether the individual alter may come or go. When an alter takes over, it can happen suddenly or to the point that the individual does not realize it is happening, or the person can be aware that they are feeling outside of their body and that something else is taking over. They will also hear talking of another voice. When they hear this voice, it can be confusing to them, or they might even hear multiple voices. Usually the person will state they have no control over these voices. The person will then experience emotions or attitudes that are expressed, but not totally of their control. The person's personality, preferences, and even attitudes can shift and then shift back again. They may state their body feels more like a kid or even a huge or muscular person. They can pretty much feel or be anything that is not like what they normally are. It can make a person feel like their body is something that it is not, or that they may not own control of their body any longer, or that any piece of their personality is of their control. The individual may not remember important life events, everyday activities like going to work, or recognize that someone else has done their task that they don't recognize. After losing periods of time, they may discover injuries on themselves, which can be very, very scary, works of art they didn't create, or writings that they feel they haven't done. Others will see them do these things and can state that they were the ones that did them. It is often seen that a person with DID will minimize their alters taking over and the time that they spent in their body. That's just a normal kind of response to alters taking over. It is normal for people with DID to have depression, self-injury, seizures that are not brought on by epilepsy, and substance abuse issues. Some are not aware of their absent states. Some might even report having flashbacks later of what happened when the alter was in control. There are many with DID that state they had traumatic childhoods with different forms of abuse. This means the disorder can come about at a very early age. It is normal to see a high degree of people that have suffered physical and sexual abuse in childhood with this disorder. Self-injury tends to be common and suicide attempts tend to be frequent. 1.5% of the population tends to deal with DID in a year's time in the U.S. 70% of patients that are not inpatient will attempt suicide. An alternative personality can be depressed and be at risk for suicide, whereas the main personality does not have this. Treatment generally shows gradual improvements in personal and occupational functioning. Most people with DID develop PTSD. Other disorders that can easily follow this disorder are eating disorders, substance-related disorders, personality disorders, conversion disorders, sleep disorders, and obsessive-compulsive disorders. DID is a controversial diagnosis because about half of healthcare professionals, psychiatrists, psychologists, and scientists believe that it actually exists. I do believe that it does exist, especially when it arises from childhood trauma, where the forebrain, which is in charge of personality, is still developing. I do believe that there can be a fracturing of the neurons as they try or assist in developing personality. Whether or not DID exists, though, it's important that all persons suffering from psychological distress are getting help with their suffering. I think it's more important to listen to what a person is stating about themselves than to place a judgment or a diagnosis on them before fully understanding what they've been through. All right. Well, that is the end of the video. If you have any comments or questions, feel free to leave them down below. I hope you enjoyed this video and that it was helpful. Thank you and have a wonderful day.